Hi, I'm Eunice. Welcome to Before a Visit Ends, a space where we take a moment to get to know the whole person beyond their cancer diagnosis. Along the way, we'll gain meaningful insights on living a life that is not defined by cancer. These stories are sometimes heavy, sometimes unexpectedly light, but always honest. During this podcast, my guests and I will be sharing personal experiences and discussing medical information. That said, the information we share is based on our own lived experiences, perspectives, and personal understanding. This podcast is not intended to replace medical advice. Please consult your own healthcare provider or licensed practitioner with any questions or concerns about your diagnosis or care. Before Our Visit Ends is not responsible for any outcomes related to information shared in this podcast. Each episode is shared with the hope that someone listening might feel seen, better understood, or more informed. And with that, let's begin today's episode. Hi, everybody. Thank you so much for listening to Before a Visit Ends. Today we have Gianna. Hi, Gianna. Welcome.
Hi, thanks so much for having me.
I'm so happy to have you today. Could you just tell our listeners about yourself, what life is like for you, and your background?
I am a mom of a soon-to-be 3-year-old. I am a fiance since February of 2025, so I'm a new fiance. And I am an esthetician, I'm a yoga teacher. I kind of dabble in a few different things. I have a lot of different passions. I am a 2 times cancer survivor now. My first diagnosis was in February of 2020, and then second time January 2025. So I'm still in the middle of my second round here.
I imagine that you have your hands really busy with a 3-year-old. How is that and going through treatment?
I think it is the hardest thing I've ever done, if I'm being honest. And I feel like I've just been doing hard things over the last 5 years. Having a toddler and moving through treatment, especially the chemo portion, was very, very hard. But I have to say that the people in my life made it feel a lot easier. And if I did not have that support, things would have looked a lot different and I'm sure would have been significantly harder.
Yeah, I can't imagine. I know we kind of dove into your diagnosis and we're going to go deep into that. I want to hear more because when we were talking on the phone, we were talking about your studio and your business and like your yoga instructing. Can you tell us more?
I had a business for 2 years and a wellness studio. So it was all of the things that I love all in one place. And the reason why I started my business was just to make women feel really good and supported, and taught a lot of yoga classes there. I did facials, different wellness workshops, some health coaching as well. And I had my son around the same time. So there was a part of me that was super naive. And I appreciate that now because if I hadn't been that naive, I probably wouldn't have done it. And I don't have a regret with starting my business. I had never had a baby before. I had never had a business before. So I
I
thought,
think most of us are in the same boat.
yeah. So I birthed two of those things at the same time. I had my son and then my business opened. So it was two really big things happening at the same time. And I was able to manage only for so long. And then I really started to feel the financial weight of everything. And as good as business was going for a startup, right, it was still really, really hard. And I can appreciate now, I had to make that really big decision to switch gears a little bit and to stop and say, like, okay, you know what? I really am craving that consistent income. I'm craving some consistency. And with having your own business, especially a startup, that is just something that was not guaranteed in the beginning.
Yeah, I completely understand. We definitely can get into your medical diagnosis, and you're pretty young. And I think your story is going to be pretty inspiring, but also hard for maybe people to hear because of how young you are. So, how old were you the first time you were diagnosed?
Yeah, I was 19 when I was diagnosed the first time and 24 the second time. So I was definitely significantly younger than a lot of the women that I've heard about having breast cancer.
So, do you have a family history of breast cancer? And maybe just like going back for the first diagnosis, what prompted you to go get tested?
The way that I found it was my son's father actually is the one who found it. It was under my armpit, and at that time, I thought it was just a swollen lymph node, so I wasn't too concerned about it. And I had gone for my yearly exam with my OBGYN, and he had done a breast examination, and I didn't say anything about the lump that I had felt because I thought it was just a swollen lymph node. Like, it was that's how much it kinda just went over my head, and I wasn't concerned, you know? And he didn't feel anything, so I didn't say anything, and so I kinda just kept going. A few months later, it was a little bit bigger, and that's when I started to be a little bit more concerned. I remember telling my mom at the time, like, "Hey, like, feel this." She was kinda like, "Alright, I think you need to go back to the doctor." And so I did. They sent me to a breast specialist, and right away after he felt it, he was like, "You need to get a biopsy done." I had a biopsy done, and things just moved so quickly. I went to my OBGYN, he sent me to the specialist sent me for a biopsy, then it was the news that, I had cancer. I was diagnosed with stage 1. I believe it was DCIS, and so, thank God it was localized, it was contained, and it hadn't spread to my lymph nodes. But because of the type of cancer, it was hormone positive, so my HER2 receptor was positive, and so that meant that it was just a little bit more aggressive, and so they wanted to do chemotherapy, immunotherapy. I had radiation done, I had a lumpectomy, and yeah, in 2025, because it was a recurrence, it was in the same breast, same side. This time, I don't know what stage it is. My doctor said clinically it looks like stage 2 this time. I found that through a routine mammogram that I go for every, I don't know, I wanna say every 6 months. I couldn't do radiation again because I had already had it done the first time, so clinically, it looks like stage 2, so we won't know until I actually get the surgery done. So can't do radiation, I have to just go right for the, single mastectomy, and then I'll be on the immunotherapy for a year, and then hormone therapy, which I did not do the first time around, just because of the way that it made me feel, and being so young, it felt like I was moving through menopause at 19, 20 years old, so for me at the time, it felt like I had caught it early enough that it felt like the treatment by itself was enough, and it ended up coming back.
I'm curious about the first time when you were deciding on treatment because you had chemo. Did they talk to you about egg preservation and like what life would look like if you were to go through this treatment?
Yeah, so I go to MSK in the Middletown location here in New Jersey, and they're very thorough. I really love all of my doctors and my care team there. They just informed me about a lot of different things. One of those things was fertility, and they talked to me about that. And they said chemo does increase your chance of harming your eggs. So there's that chance that you may or may not be able to become pregnant after chemotherapy if you choose not to freeze your eggs. So they gave me the option. It was the pandemic, right? So I was diagnosed in February, and then March of 2020, it was everything was locked down. I remember my surgeon saying to me, she's like, "Listen, if this was my daughter, like I really wouldn't want her going into another care facility risking exposing yourself to COVID." Like at the time, nobody really knew anything about COVID, and so they were kinda leaning towards, like, not doing it, that was her personal opinion, it wasn't like a yeah, it was just her personal opinion, which I valued a lot at that time, and I was afraid, so I prayed about it, I was like, "If God wants me to have a baby, I'll have a baby, regardless of if I freeze my eggs or don't freeze my eggs." And then luckily, I was able to have my son. I had my son in October of 2022, and that was not planned, but it was a miracle for sure because I had just been praying for him. I had dreams about my son like 6 months before I became pregnant. I just had dreams of holding him and nursing him and loving this unborn baby. And then I became pregnant.
You went through treatment, things were fine. You had him. It's almost like a break in between for you to just have this miracle. And then, unfortunately, then you got re-diagnosed again this year. But it was almost like a break just for you to have him.
Yeah, it does feel like that, and I like the way that you're reflecting that back to me. Sometimes you don't really see things as clearly when you're in it, so to hear that, it's like, wow, yeah, that feels really true for me, actually.
How is it with friends your age? Do you feel like they understand a lot of what you're going through? Like, how has support been
just cancer alone is extremely isolating. Even when you do have friends and family that love you and want to support you, it's still so isolating because no one truly understands unless they've really been through it. But I will say that my friends have been such a beautiful support system for me throughout all of this. And it's interesting and kind of funny because the first time around, I feel like I had more people texting me, calling me, sending me gifts, sending me flowers, praying for me, that kind of support, which felt really sweet to be thought of. But this time around, it's a different kind of support. It's smaller. I have my closest friends really showing up for me, like really pouring into me, asking me if I need groceries, bringing food over to my house, cooking for me while, the week after chemo when I'm feeling really sick, meal prepping for me, watching my son so I can rest on the couch. Just really, really supportive. And I appreciate all of it. Like, I appreciate the text. I appreciate being thought about. I appreciate being prayed about because I need that too. But to really be shown up for is something I wish and pray for everyone to have in their life. But it definitely is isolating, especially at my age, and then to also have a son. It's like cancer and then also having a son while going through cancer, and then all of my friends don't have children yet, so there's, like, that added layer of isolation where it's like, nobody gets it.
You're figuring out going through treatment, cancer, but then also figuring out how to be a mom at a young age.
And I tried to keep things so lighthearted for my son, even when, going through all the physical changes, losing my hair, like, I tried to make everything feel as light as it could feel. And I was like, "Okay, you wanna give mommy a haircut? Like, today we're gonna we're gonna buzz mommy's hair. You get to use the buzzer." Like, I tried to make it fun for him rather than let him in on the heaviness. I think he already felt that just because I feel like babies are so attuned to their mothers, and he was very intuitive to certain things. Like, after chemo, when I was feeling very sick, he wouldn't even really ask me to get off of the couch because he knew I couldn't. So he would play with my friends. He would easily go with my parents, so they could spend time with him while I rested because he just knew that I needed rest, which is just so beautiful. And I'm gonna cry because I love him so much, but he's just like more resilient than any toddler should really have to be, seeing their mom move through this. And there's so much that he doesn't understand, but there's so much more that he did.
The beginning of this podcast is that these stories are sometimes heavy and then sometimes they're light. And that's a heavy moment. But then there's also light because he is light. Talking about him is light. They understand so much more than we realize. And sometimes the things that they say back to us are like very shocking.
Yeah, I was telling him just the other day because I have my surgery coming up. And I told him, I'm like, mommy has to get a surgery. Mommy's gonna have a big band-aid on her chest. Like, just so he's not freaked out and just like completely alarmed by it when he sees me, but just giving him like that little heads up of like, yeah, mommy's boobies have a boo-boo. And so the doctor is going to help me to get better. And he's looking at me and he's looking at my chest and he's like, you're gonna be hurt? And he started to cry. Like, he's like, you're gonna be hurt? And he was, yeah. And I'm like, like, then I'm crying. I'm like, it's okay. The doctor is helping me, and this is what mommy needs to do to get better. He's just had to roll with it over here, and he's been doing such a great job, and he's just so empathetic and loving, and it's just been really beautiful to have him by my side.
He sounds like a gift. So, right now, as you're going through treatment, what are some of the things that you've been doing that just kind of like brings you joy?
I've been cooking a lot. I really am enjoying cooking right now. I've always liked to cook, but I'm just enjoying it so much. It's really filling my cup to be able to cook my own food and to make my family food and to see them enjoy it. That's bringing me just so much joy. I tried to pick up crocheting. So I have to give her a big shout out because her name is Zoe Berry and she's on TikTok and she went to culinary art school. So she's a chef, but she makes these dinner menus for the week. And I just think the way she does it is so genius where she'll give you the entire grocery list of what you need to get. And then we have a prep day where we prep. She has like a Substack and all of her followers and like subscribers are inside of it. And we all just kind of like share the pictures of the meals that we make. And it's just been a lot of fun for me. Everything is just so delicious. And so we prep everything on the same day. We cut up our vegetables, we make our doughs, we get everything that we need for the week, the sauces and everything. I don't know, they feel like extravagant dinners, but it feels simple.
And it's for like the whole week.
Yeah, it's for the whole week. It's 5 dinners, and I love it so much, and I think a huge part of that is because I wasn't able to eat with chemo. It just made my mouth feel so strange. It's just one of the horrible side effects that it was really hard to get food down, and so I think it was by my last treatment that I just couldn't eat anything. It was like an entire week that I didn't eat, and feeling that hungry, I became obsessed with food. Now I that I can eat, I'm going to eat, and I'm going to eat well every chance that I get.
Yes, I love it. Please eat. They sound really delicious. I'm actually gonna check it out. I'll have you text me after. You were gonna say about crochet too. I wanted to hear about all the food, but I know you were also gonna mention crochet and maybe something else.
Yeah, I was just saying that I tried it because there was so many days that I was just sitting on the couch doing nothing and feeling like, "Okay, I need to do something." And so I tried crochet. I just kept making tiny squares. I can't do anything else. I'm kinda over it already, but I thought I was gonna be, like, really into it, and I thought I was gonna make all sorts of things, and maybe I will one day, I don't know, but right now, I'm just kinda like, "Alright, I can make a square, and that's about it." Even my fiancé were just joking about it because sometimes I start little things, and then I'm kinda like 2 seconds later, I'm kinda over it. I'm like, "Okay, I was really fascinated by it, and now I'm just kinda like, whatever." So, I would make these tiny squares, and we would just joke about it that I was making blankets, and they were these tiny little things, and I was like, "Are you cold? Do you need a blanket?" I'd put this tiny little square on him, and he'd be like, "Yeah, thanks. Appreciate that."
That's so cute. Have you found like a community of other people who are also going through cancer?
At first, I was very hesitant to join any kind of support groups or to put myself out there in that way with other people going through the same thing. A lot of it had to do with just being in denial, like feeling like, "Oh no, that's not me. I don't fit in there." When it's like, "Yeah, you do. You definitely fit in." Once I opened up to it, I applied to Mary's Place, which is in Ocean Grove. And if you don't know what that is, a retreat center for cancer patients. And you get to stay a night or two free. They take care of everything. And you get to do yoga. There's creative writing classes. There's oncology massage. There's like so many different offers that they have there that you get to just enjoy. And you get to connect with other women, and that was one of the most beautiful parts about it, was getting to connect with other women who have been through the same thing and feel like, "Oh, I'm not crazy for thinking that." Like, "Oh, you thought that? You think that too? Okay." Just feeling that sense of community and feeling like, "Wow, I'm not alone," as much as I feel like I am. There are other women battling the same exact thing.
I think I'd heard of Mary's Place. I'm glad you mentioned it, and hopefully other people could maybe check them out to have such a community. That's beautiful.
It's really beautiful. Yeah, and all of the women that stayed there that night, like, we all made a group chat, and we kinda connect through there and stay in touch here and there, which is so beautiful. It's like you go to just get away, and you end up forming such beautiful connections that you carry with you.
That's awesome. The first time or even this time around, it sounds like you have a really great care team. Do you feel like you were able to get like a lot of your questions answered and you felt like you've been sort of prepared every step of the way about what's coming and what the treatment is going to be like?
Yes and no. My doctor did a great job of informing me about the side effects and things to expect, and there was still nothing that was going to ease the anticipation of starting a treatment I've never done before, and just the not knowing. I'm very appreciative of my care team. They were very thorough, but I still think there is that gap of like, yeah, well, this is still just something I've never done before. So no matter how much or how informed I am, you don't know until you really experience it firsthand. They did answer a lot of my questions, but in the beginning, the first time around, I didn't really know what questions to even ask. And of course, if I had questions, they would answer them, but I just don't think I even knew what to ask the first time around. Whereas this time around was so different for me because I did lean into more of the support and more of the resources that they have available to patients that I just didn't know about the first time around. For example, their integrative therapies. I didn't know that they had that at their facility. And so this time around, I asked about integrative therapies. There's a practitioner that they had on site at MSK. And so they introduced me to her. I got to have an appointment with her. And that's kind of I was able to be supported in a different way outside of just the conventional treatment. I think that's a good question to ask. Like, are there any integrative practitioners that you can recommend to support me in addition to the conventional treatment plan that you have here? And there's another question too. Is there a social worker on site that could support me and provide me with resources? That was something I didn't do the first time around. I just didn't know that it was even an option. And so this time around, I did work with a social worker and she was able to support me, give me resources, financial resources. There are so many companies, so many nonprofit organizations that are willing to help and want to help. And if you don't know and you don't have access to that information, then, you miss out on those things and you might really be struggling and might really need them. For example, there was one business called Cleaning for a Reason, and they offer 2 free cleaning services for people that are struggling, And so that's such a beautiful thing, like, to have someone come in and clean your home while you're not feeling well and good enough to do it. It's just such a beautiful, beautiful thing. So many things like that that I just didn't even know I really needed. Do you know what I mean? It's like I would have never thought to ask for, "Hey, do you have a cleaning service here?" It's like you're not thinking that there's even that option. So that's why anyone that I know going through it, I like to share these things because you just don't know what you don't know.
You're providing such really great resources. I really appreciate them. And I think our listeners are really going to appreciate them as well. When it comes to the medical questions as well, are there any like medical questions that you could think that like someone who's newly diagnosed should be asking? The reason I'm curious, and really one of the main reasons I wanted to start this podcast is there's a lot of times when this is sort of how we're treating, and there are, questions around, so you had the cancer the first time, now you have a recurrence. Are there conversations around, like, what does that mean that you've, like, asked your doctor, for example? And those are hard questions sometimes.
Yeah, just asking your doctor, like, what are my treatment options? Maybe there's more than one option, and it's important to explore other options if that's something that you're curious about. So asking them, what are my treatment options? What do you recommend? And then also tuning into your body, like what would feel good for me. For example, when I had to consider my surgery, the options there, it was either go flat, it was get implants, either silicone or saline, or it was I forget what it's called, but it's where you take skin from another part of your body and then, they use that skin to create a new breast. So there was like all of these different options and none of them really felt good to me. I had to speak with the plastic surgeon, because my surgeon who was doing the mastectomy, she was kind of recommending, like, yeah, do the reconstructive surgery, and I just wasn't sure if it's something that aligned with my values and what I really want. So I think that's important too to ask yourself, especially with surgery, right? Like where you have options. Sometimes it's like treatment wise, it's like, okay, if they're recommending to do chemo because your cancer is aggressive, yes, do the chemo. I don't want that to get lost in translation. Like, that is very important to listen to your doctors and what they're recommending, but asking about options, like, what are my options here? Do I have any options here? And so I had to speak further with my plastic surgeon because I didn't feel good about just saying yes to reconstructive surgery. I wanted to know what that looked like. What does recovery look like? What are the risks? What are the benefits? And kind of outweighing those myself just to have a more informed choice. If you have a family, you might choose something different than if you don't have a family. Like, for example, with my surgery, with all of those options, I thought, if I want to have another baby in my future, if God willing, like I am able to and I am healthy, then I would love to have another baby and I would love to breastfeed my baby. So keeping one of my breasts was really important to me. And if I had done implants, there's more risk for infection because I had radiation already on one side. And so the risk there, it didn't outweigh the benefit of having implants. If I was gonna do implants, like, oh, I would have wanted to do a little bigger, like, okay, great, I get to have this surgery, like, might as well. So that was kinda my thought process, and then I'm like, well, then the implants could affect my breastfeeding if that's something I wanna do, and then it was like, okay, gee, like, alright, let's sit down, let's sit with this, like, do you care more about feeding your potential future baby, or do you care more about having big fake boobs. And that's just my like that's just how I was looking at it. Everyone's going to look at it really differently, you know? And if you're someone who like you're not considering having children or breastfeeding isn't the most important thing in the world to you, then like you may choose the implants and that's great. Whatever aligns with what you value most is going to be the option that you go with. And I just remember being so conflicted because there was a huge part of me that's like, well, I do want to feel good about myself. I do want to look good when I look in the mirror. But after talking to the surgeon, there was just too many risks that didn't feel worth it enough. Any of those decisions was going to be hard. I hated all of the all of the options, you know, but going flat felt like the option that aligned mostly with what I care about. Whatever it is, whatever decision you make, you're going to have to process it. So for me it was okay, well this is what I value the most and okay, great. It sucks. Any of the options would have sucked. So now I just have to process.
You're comfortable with the decision that you made because you got a chance to like think through the different options and maybe not necessarily just go with one that was mentioned. This is the one option and you just went with it. It sounds like you've really explored the different options. And like you said, if I know I have an aggressive cancer, I know I need to do chemo. Maybe I'm not a doctor to say this is exactly the chemo I need to do, but there's other options in it to allow yourself to be able to be the one that's like making some decisions that works for your life and your future. What are you looking most forward to after you're done with treatment? What are you most excited about for the future?
I'm excited to get married. I'm excited to start planning. We haven't started planning yet, just trying to get through this year. But it's something that's been giving me a lot of hope and something to look forward to. So excited to start really thinking about that. And it's really small things, the things that I'm looking forward to. Like I feel like I've done a lot of big things and a lot of hard things over the last few years that right now, like all I'm looking forward to is spending quality time with my family and with my friends. I'm looking forward to getting married. I'm looking forward to building my family, looking forward to just really normal things. Nothing crazy.
Like normalcy to your life every day to day that maybe for some of us we take for granted, but truly it's like just having peaceful, no more treatment. And I'm excited for you to be a bride. I'm sure you'll make a really beautiful bride.
Thank you so much. Yeah, it's so funny. I was talking to my mom when I was going through treatment, and this was on one of like the really hard days that I was having physically, emotionally. It was just a really hard day for me. And I remember telling her, like, if I never have to do anything hard ever again, I'd be really happy. You know, I would be really happy if I just never had to do anything hard again. And I know how that can sound. It's like, you know, you're in the middle of treatment, you're in the thick of it. Maybe you don't mean that. But I also think that it's really beautiful. Like the mundane things can be really beautiful too. That's what I meant. Not that like I don't want to keep going or I don't want to have to do something hard. It's like I just want to live a really soft life now.
I completely hear you. Be able to go to work, have a paycheck, to go on vacation if you want to, and just enjoy time with your family. I think that's not asking for too much. So, we are coming up on the end of our episode. I am curious if you have any advice, whether it's medical, psychological, anything that you would want to share with our listeners for somebody that is also going through cancer, has gone through cancer.
I say listen to your body, trust your body, tend to your body, take care of it, take preventative measures that are known to preserve your health. Even before the cancer diagnosis, if you just for some reason happen to be listening to this podcast and, you know, without a diagnosis, just taking care of yourself, it goes so far just to do the really simple things. And I was talking to my integrative practitioner and nutritionist, and this is something important that I wanted to mention. I remember after choosing to do chemo again, because that was what my doctors recommended, and I really didn't want to. I'd been through it once before. I know how rough it is on my body, and I was really looking for something. I'm like, is there something else? Like, isn't there something more natural? Isn't there something else I could change about my diet? Is there something that I just don't know about? You know, and so I was kind of driving myself crazy with that thought of like, is this doing more harm to my body than good? And I was talking to my nutritionist about that. And she's like, listen, like I hear you. Like there's a lot of noise on social media and, just different platforms where you see people saying, "Hey, I changed my diet and my cancer vanished and, and now I'm living this really awesome life. Here, do this protocol." And she was like, there's nothing to back it. She said, and a lot of the times you're not seeing the full story where maybe they had surgery, right? Like maybe they did have the surgery and maybe they just refused chemo, but maybe their cancer wasn't as aggressive where the surgery was enough, but maybe they didn't share that part of it. She goes, and that she also had patients where they did want to try the more natural approach. They wanted to change their lifestyle, see if they could do things on their own. She goes, and oftentimes those patients come back and their cancer is worse, and it's spread. Whereas maybe their treatment wouldn't have been as aggressive if they would have just done the conventional treatment that was recommended in the first place. So I just feel like that's important to share because I got caught up in that and I was beating myself up for like choosing the treatment that, is known to get rid of cancer and that has been studied for a really long time. And so I wanted to make sure that was something that I mentioned. But going back to like preserving your health and taking more preventative measures, my integrative practitioner also said, she's like, listen, it's the nutrition, it's the movement, it's moving your body, it's exercise, it's sleep, it's making sure you're hydrated, it's avoiding harmful substances. She's like, it is those foundational things that have been shown to preserve long-term health. And those are the things that are often overlooked and people are looking for, they think that there's something else out there when it's like, don't come back to the foundation of health and those really simple things, but often overlooked things. Early detection, like if something feels off in your body, don't ignore that. Get tested for something or go to a doctor and bring it up, be loud about it. Like I wasn't the first time around. I was quiet about that because I thought, oh, okay, like it's probably not cancer, it's probably not me. And I don't say that to instill fear either. I think that there's like that line between like, okay, you might hear my story and think, oh, I have to go get checked now. And that's not what I mean. I think it's just like when you get those intuitive hits of like, oh, something feels off, okay, go. Like you don't have to just go running out of fear. But like if something genuinely feels off to you in your body, like, yeah, address it, and don't be quiet about it. Yeah, just taking care of your body physically, mentally, emotionally, nervous system regulation so important. Stress management has a lot to do with our health. Just, yeah, different stress management tools. It's interesting because the first time I had cancer, I didn't have these tools. I was into yoga, I was into meditation, but I didn't have the tools that I have now and that I've worked on over the last few years. So getting cancer again the second time, it was more aggressive, the treatment plan. However, I had a better head on my shoulders because of all of the tools I learned, because of the nervous system regulation, because of stress management, because of knowing how to prioritize my body. This time around, I moved through it with so much more ease, so much less anxiety. And it was because of those things, that I chose to educate myself about and to really dive into to help take care of myself, like mentally, emotionally, and physically. So that's really important too. If you don't have a diagnosis and you just happen to be listening, it's so important. So then when these big life things do happen, it's like, okay, I can handle this.
That is such great advice. Thank you for taking the time to write these down, to try to get these out there for anyone that's listening. I think that it's going to truly, just me listening to you are things that I think I want to take in for myself and really think about. Because like you said, it doesn't have to be while you're sick. It could be before and any time in your life. And it sets you up for success. So, really great advice. I appreciate the time to be able to give this type of advice, to be able to hear from you. So, thank you so much.
Yeah, thank you for having me on. I really appreciate getting to share a little bit of my story here.
Although this visit has ended, I hope this story stays with you and you can share it with someone who might need it. Until next time, take care.